We go. Well, welcome. In the series I'm calling Reflections from Pharmacy Leaders Advancing the Profession. It's my pleasure to have with us here today Nahata, who is the director of the Institute of Therapeutic Innovations and Outcomes at the Ohio State University. He's also a professor emeritus of pharmacy, pediatrics, and internal medicine at OSU. He also there previously served as department chair of pharmacy practice. Dr. Nahata has had an outstanding career in clinical pharmacy education, practice, and research at OSU since 1977. He's a prolific writer. He's the editor-in-chief of the Annals of Pharmacotherapies, a past president of ACCP and AACP, and was also recognized with the Chalmers Distinguished Teacher from AACP a few years back. So welcome, Dr. Nahata.
Pleasure to be with you and with your students.
Thank you very much. So we'll start off. We would like to learn more about your career journey to your development and ultimate recognition as a leader. And in reflecting on that, you may want to include key events that really impacted or influenced you in your journey, or persons that influence you as well.
Sure. Well, I grew up in India, and I was 23, and the opportunity to come to U.S. opened, and that was one of the key events that happened and opened so many doors of opportunity when I came here in 73, actually. And initially, I thought I would do a PhD in pharmaceutics and work in industry, in drug development. But then, so I was in the master's program, and another key event that happened was I discovered this something called PharmD, which I never heard of before. My plan was to finish master's and going on to a PhD program at Michigan. And then I heard about this PharmD, and I really fell in love immediately that I could do something that could help people every day with my work in patient care. And I was also a TA at that time, teaching assistant in the lab. And I discovered also that the teaching was my passion. And I never knew that I would ever go into teaching profession. And so teaching and practice, and then I did a research project in both masters as well as in the PharmD. So I fell in love with the idea of discovering something new that could help people improve their life. And so all three really became love for me, and it made sense to only pursue academic career with all three interests. So that's what really was the reason why I came to Ohio State to pursue an academic career. And I have had a tremendous journey. And after I came here in internal medicine, and then pediatrics appeared to be an area that needed a lot of help and work. And another risk I took, changing from internal medicine to pediatrics, because in those years, we didn't train people to be a pediatric pharmacist. We trained them to be a generalist, a general clinical pharmacist to work in internal medicine instead of being subspecialized. So there was another risk, but it paid off because I really felt a need in those areas. So that has been a journey, and I've enjoyed being active in professional organizations as well as being in academic life at Ohio State. 43 years, and it doesn't feel like 43 years. It feels like I've been here only for 5 or 10 years.
Wow. Thank you very much for those insights on your journey. So the next question has to do with legacy in 20 or 30 years. And I rephrase that question by asking people to reflect on what are they most proud of in terms of their contributions that really has helped advance the pharmacy profession.
Well, there are so many things that I'm so proud of. And I think probably I would put most importantly, training and educating students and residents and fellows. I've had more than 5,000 students, and I've taught in required courses every year in the pharmacy program. And I've had more than 200 residents and fellows and students who have worked with me in the lab or in the clinical research arena. And I have kept in touch with all of them over the years, and it has been a wonderful journey. I would put that at the top, but equally important is doing something that is meaningful, that makes a difference in people's life. So I've been very cognizant about choosing projects or choosing to do what I felt was going to be most impactful.
Mm-hmm.
And doing that what is for common good rather than what helps me personally only.
Mm-hmm.
So I have that service component in my mind in everything I do, that it is not just for my own promotion, it is for the common good. So I hope people would view me as a person who worked extremely hard, who was patient, who was resolved, who believed in common good and did his very best. He tried his very best and never gave up.
Mm-hmm. Excellent, excellent. Thank you very much for that. So advice for students in their professional journey, and we hope, the intention is to develop people as leaders, often little L, so they could help influence others to really change or advance the profession. So what words of advice would you like to give our students?
Well, I think what I learned from my life is that, really be open to ideas and really be reflective and listen to what other people are doing. Be curious. I would say it starts with curiosity.
Mm-hmm.
That chance meeting that I had at Duquesne University when I was a master's student, and I ran into somebody who was a PharmD student. And all I asked was, you must be a PhD student. This must be a typographical error on your lab coat. He said, no, I'm a PharmD student.
Mm-hmm.
And I could have stopped right there to say, well, nice to meet with you.
Right.
But I said, what is PharmD? Tell me more. And I really kept asking questions. And next day I was at Mercy Hospital to see what he did as a PharmD. Mm-hmm. And that curiosity, sense of curiosity, I hope will live with me for the rest of my life. And that's number one. And number two is hard work. Nobody can work harder for you. You are driving your own ship. So really giving it all, with dedication is really the key, that you work as hard, but of course smart. You don't want to commit to everything. I had invitations to serve on more things that I have said yes to. And always be careful about prioritizing what makes a difference, what would make the most impact, and what would be most good learning experience for you. Mm-hmm. Because if it is just, again, another type of thing that you already done before, your learning curve is not going to change very much. So what gives you the opportunity for your own growth and development while you're doing something that's really impactful? So I think having that ability to make choices that are going to be most meaningful to you and for the world, and then giving it all, and then be really patient about everything. Doesn't happen in one day or 1 year. You just have to, and then take some risks, like I did, going from pharmaceutics to, pharmaceutics to clinical pharmacy, and then from internal medicine to pediatrics. And then about 8 years ago, an opportunity occurred to start a telephonic medication management program that I started at Ohio State with one pharmacist 8 years ago for elderly people. And really a lot of people said, why are you doing this after being here for 36, 37 years? Why do you want to take this risk? I said, but there's so many people who are taking 10, 12, 15 drugs, and nobody's helping them. This is an opportunity. Let's start. Started with one pharmacist. Now I have 22 pharmacists, and I have 24 technicians, and 130 students that are working in the call center. Every day we go through the medication that the patients are taking, and they're so confused. The patients are so confused. It's really making a difference in people's life. While they're at home, we call them to check how they're doing, resolve the medication-related issues, and helping reduce the ER admissions and hospitalizations and improve quality of life. Wow. So it's really great for education. Students are learning every day. It's not just taking a test and forgetting about it. 10 hours a week they're working for us while we are paying them. And it's a great practice model because these are the patients nobody has ever talked to. in community pharmacies. They're doing a good job, but no, they cannot reach everyone.
Mm-hmm.
So and then we are doing research now because we have millions of lives that we are covering.
Wow.
So research opportunity, and it brings some revenue to the college.
Wow.
So it's a win-win-win-win.
Yeah.
4 wins.
Wonderful. Wow. Thank you for those comments. Any other comments you want to make for our students? I mean, you said a lot. Anything else you think, or?
Well, be optimistic,
Okay.
be hopeful.
Yep.
We are going through currently the situation that was totally unexpected. I never have taken more than 4 days to be at home, and most of us can say the same thing. Unless you're on vacation, you never take long time to be home. I don't like it, but it's the way the new life is right now. Mm-hmm. But things will become better. And having grown up under difficult circumstances in India, I can relate to it, where I didn't see any end. Here, at least, I can see an end at some point. Okay. Hopefully there would be a vaccine. Hopefully there would be some treatment, as we have done for other kind of challenges. So these things happen in life. The question is, how do we adapt? How do we become flexible to make sure that we accommodate these things in life, and stay optimistic and be hopeful and keep doing, don't lose that enthusiasm and excitement that is so important to keep on going.
Excellent. Thank you. So my final question, this is part of a history, of course, and also looking at the leadership behind our history. But as we study the decade of the 2020s, one of the major events in that decade will be the COVID-19 pandemic. Like other key events in our history, key events have shaped our profession. So how do you see this pandemic shaping our history, and in particular as we study it in 20 years, 10 years, where we will have seen it as a major turning point and an opportunity for our profession?
Well, a very good question. And a number of things I think we can learn personally about what's important in our life. It teaches us about what is really important, in terms of priority. Mm-hmm. That's number one. And number two is professionally. I think there are so many people that our health system currently does not reach. And I think the pharmacist, as we all know, the pharmacist is one of the most accessible healthcare practitioner. Mm-hmm. And the question then is, are there areas, for example, immunizations and even providing testing kits, and all these things that currently are gaps in our healthcare system, this COVID-19 has brought them up mm-hmm. to our awareness. And I hope that we as a profession can really approach our legislators and people that are serving publicly to our society to see what role pharmacists should be playing in the future, in terms of healthcare. Mm-hmm. Because currently we have gaps, especially in rural pharmacy. Mm-hmm. And another area is social determinants of health. As you know, that even among the people, we have about 85,000 people that have passed away. If you go deeper into the number of cases that are positive and number of people that we have lost, there's a tremendous disparity. Mm-hmm. The people that have less in terms of access to healthcare have been more affected mm-hmm. than persons like me, who are well covered by insurance. Mm-hmm. So I think this brings up the opportunity for pharmacy to play a more important role than we are currently doing. And I've heard the APHA and ASHP and all the organizations are now trying to get coverage for pharmacy services under Part B, like boy, mm-hmm. to get paid for testing, to get paid for counseling, to get paid for immunization, all those things. So I hope this really will bring up the problems that we currently have in our healthcare system.
Mm-hmm. Excellent. Thank you very much. Sure. I really appreciate that very much, Dr. Nahata. It's always a pleasure. Thank you.
Thank you so much. Great to have known you and worked with you over the years. And I wish you all the best and all the students all the best.
Thank you.